Today, Attorney General Jeff Sessions announced about 400 arrests related to healthcare fraud schemes, totaling over $1.3 billion that were apparently stolen. Among the 412 defendants, 120 were charged with opioid-related crimes. And so that is certainly, considering the epidemic that we're in the middle of, that's the sort of thing you want to see. People who are theoretically getting people addicted unnecessarily, pumping the marketplace full of pills that aren't needed. That can cause a lot of the problems that we're seeing. There are potentially some bad sides to this, but why don't we turn now to the Attorney General, who is announcing what's been done.
The Department of Justice, in conjunction with the Department of Health and Human Services, is announcing the largest healthcare fraud takedown operation in American history. The Department of Justice coordinated efforts between our criminal divisions, U.S. attorneys' offices, Health and Human Services, and more than 1,000 state, local, and federal law enforcement agents to charge 412 defendants, including 56 doctors. These defendants have defrauded taxpayers of approximately $1.3 billion. As a result of this operation, 205 healthcare providers are now in the process of being suspended or banned from participation in any federal healthcare programs.
You're the worst.
I'm a bad guy.
Okay, let me give you an idea of some of these schemes that people were eventually arrested for. He talked about doctors. 6 of the doctors were charged with operating a scheme in Michigan to prescribe patients with unnecessary opioids, some of which were then sold on the street. We understand that's a big problem. The doctors allegedly billed Medicare for $164 million in false and fraudulent claims. That's a lot of work for 6 doctors. I mean, no, I know they make a lot of money, but that's more than you would imagine. A clinic in Houston allegedly gave out prescriptions for cash. That's how it works, actually. Officials said one doctor at the clinic provided 12,000 opioid prescriptions for over 2 million illegal painkiller doses.
Wow.
That is insane.
My favorite was some of the doctors wrote so many prescriptions for controlled substances in 1 month than an entire hospital did.
Wow.
It's amazing, man.
One of them wrote so many prescriptions, his hand was hurting, he had to take opioids to calm down the pain. A rehab facility for drug addicts in Palm Beach is alleged to have recruited addicts with gift cards, visits to strip clubs, and drugs, and it billed the government for over $58 million in false treatment and tests. And so, like, this is to give you an idea, like a lot of the people arrested did not get those huge sums, obviously. We're talking about $1.3 billion overall, and that's about 3 clinics did several hundred million of it. But this is obviously a huge issue. This is not going to solve the problem. Even the money that's currently being allocated in what could potentially become the new Senate healthcare bill, if that becomes law, is not enough to by itself solve the problem. But to remind you of the problem, let's bring up this chart that we've shown you several times before on the show. That is the increase in drug overdose deaths. Now that is of course not limited to opioids, that's all drugs, but opioids are an increasing percentage of it, and you see how that is just shooting up. That is a societal problem. That is a problem with regulation of the pharmaceutical industry and doctors and their ability to prescribe things, whether they're actually needed or not. And it is killing tens of thousands of people every single year.
So I remember having covered this a long time ago, and a doctor wrote in that I really like and said, no, the doctors wouldn't do this, right? And come on, guys, most doctors, of course, wouldn't do this because there's a lot of different ways to make money, but they mainly, I give them the benefit of the doubt, which I think they have earned. They mainly went in to do the right thing and to help people and cure people. But are there bad folks in each profession? Of course. So, when there's this much money to be made, yeah, you're gonna find a couple of 100 doctors in the country. And in this case, it's 115 doctors, nurses, and other licensed medical professionals who are willing to do the wrong thing for given enough incentive to do so.
Yeah.
So look, I think the real gateway drug is prescription painkillers. And I think saying marijuana is a gateway drug is completely counterfactual. It's not true. We know what the gateway drug is, and in this case, it is a very clear line from those legal drugs to heroin, because they can't get either the prescriptions filled anymore or they can't afford it anymore, and heroin's cheaper, and then there's fentanyl, and then you're dead. So having said all of that, and putting the spittoon aside, I actually want to give them Sessions here in the Justice Department credit. And Sessions is not a guy I'm awfully fond of, but this is a nice operation. And And look, this thing kills 59,000 people a year. If any terrorist group killed 59,000 Americans every year, we would invade 17 countries to fight back against it. But in this case, they put 1,000 law enforcement agents on it in 30 different states. So great, at least some sense of proportion for how big the problem is. So a job well done here in getting these arrests.
And hopefully the investment made in getting these 400 people theoretically will stop far more from actually doing these sorts of fraud schemes in the first place. The last comment I want to make is I alluded to the bad side of this, and the bad side is not in who was arrested or anything like that. But Jeff Sessions, while I'm glad, like Cenk, that he's taking this seriously because far too few people are taking the opioid epidemic seriously, in his extended comments talked a lot about the massive drug epidemic that we have and drug dealers all over the country. And he there is not talking exclusively about opioids. And we know Jeff Sessions' background. We know what he thinks about his recent comments about the DARE program and how that's needed, how we need a new war on drugs. And he's not just talking about prescription painkillers. He wants to go after vigorously legal marijuana wherever it is, illegal marijuana as well. And that's the sort of thing that unfortunately will get a lot more people arrested and not people who are defrauding the government of hundreds of millions of dollars, people who are simply smoking a little bit of marijuana. That's who Jeff Sessions is historically, and I'm worried that he could theoretically use this sort of thing to pursue that agenda in the future.
Marijuana has nothing to do with opioids, except for the fact that whenever you legalize marijuana in a state, opioid abuse goes down because marijuana is a much safer and much more cost-effective alternative to painkillers. So that's part of why the drug companies are the single largest donors to politicians. They need to protect their monopolies, plus they need to keep that war on drugs going, otherwise their profits are going to go down. But war on all the wrong kind of drugs. But again, I'm going to go back to giving them credit here, because finally we're targeting the actual things that are causing the problem, which is the prescriptions drugs in the first place. Help us build independent media together. TYTnetwork.com/join.